Welcome and good afternoon to all our viewers out there. My name is Sam Furman and I work with Ochsner Health's Human Resources Talent Acquisition Team. Today, I'll be facilitating a very unique virtual talent talk discussion with a group of nursing panelists exploring Ochsner's River Parishes region. We are joined today by a dynamic group of nursing leaders from Ochsner's River region to discuss a variety of topics, including but not limited to the work culture of the River Parishes region, the benefits of working within the region, and the current opportunities available to join this growing team. I would now like to allow our group of panelists to introduce themselves and share a little bit about the work that they do here at Ochsner Health. Let's start off with Renee Roy.
Hi, thanks, Sam. My name is Renee Roy, and I am the Director of Nursing for the Telemetry and Medical Surgical Unit at the Ochsner Medical Center campus. The Med-Surg unit is a 30-bed unit, and the telemetry unit is a 43-bed unit. I've been with Ochsner for 17 years. Thank you.
Thanks, Renee. And thank you for your service with Ochsner. That's quite a wonderful tenure, so we appreciate your service. All right, we'll move on to Tina Gibson.
Hi, my name is Tina Gibson. I am the director of the ICU. I've been with Ochsner for 28 years. We have a 16-bed medical surgical ICU with cath lab patients that was newly renovated and opened in April of this year.
Excellent. Thank you, Tina, and thank you for your service as well. Mary, let's move on to your introduction.
Hey there, my name is Mary Vitte. I am the nursing director for Ochsner River Parishes Emergency Room, which is a freestanding emergency room in Laplace. And I'm also the director of the house supervisors and the risk sitters at Kenner. I have been with Ochsner for 11 years, and I love it.
Thank you. And thank you also for your 11 years of service. I feel like I'm thanking everybody for their service, but it really is, it's very nice to hear employees staying at a organization for such some time. And I really honestly think that that speaks to the culture, which we'll talk about, you know, people wanting to stay within the organization and grow their career for, you know, that amount of time. So thank you all. And let's also finish the introductions with Brooke.
Hi, thanks, Sam. So my name is Brooke Vern, and I am a recruiter for the River Parish region. And my role as a recruiter is really to get you connected to our leaders at Ochsner, more specifically our River Parish leaders. And so my role is really going to be as like a point of contact for you to kind of help you along the way while you're interviewing and just answer any questions that you may have, you know, as you go through the process.
Thanks, Brooke. So with our introductions all complete, I really want to start out now by doing that deep dive into some of the questions to give you all an idea of the River Parishes region. And I'm going to start this first question out and direct it to Renee. And the reason behind this question is really understand the facilities within the River region and what they are and be able to identify them. So Renee, could you please review and identify the Ochsner facilities that are considered to be part of the River region?
Sure, Sam, absolutely. So the River region is made up of 3 facilities. We've all been speaking about Ochsner Medical Center, Kenner, where we are all located, and that is located in the city of Kenner. The River Parishes ED, which Mary shared, that is where a lot of her scope of responsibility is, and that is located in Laplace, in the city of Laplace. And then St. Charles Parish Hospital, which is located in Luling. So those 3 facilities comprise the River region.
Thanks, Renee. Tina, this next question is for you. Now that we've identified the facilities that comprise our river region, can you talk a little bit more about some of the various patient populations that are within the region and really frequent our facilities? And what are some of the details about these various patient populations as well?
Sure, I'd be happy to. We have the neuroendocrine tumor program, which is a difficult to diagnose cancer. And we have patients that come from all over the country and sometimes outside the country to seek care from our physicians here. We have a team approach to taking care of patients with this cancer. And once we diagnose it and confirm, then they a lot of times have surgery and they end up in the ICU and then go to Renee's floor post-op. And they may spend a significant amount of time or go back and forth with the workup and do some other outpatient treatments. We do have other cancer services here. We have outpatient therapies, and we're growing treatment options there as patients want to get care close to home. We have another large patient population of general surgery. Some planned, some just show up in the ER and have, perfed colon, or we see some trauma patients come into the ED, which a lot of that goes to UMC, but every once in a while we'll see one make it up to the ICU. There's a large orthopedic patient population, which is generally outpatient same-day surgery, but there, some of those patients do make it in as inpatient. Some come into ICU for an extensive neurospinal procedure requiring an overnight stay in ICU for airway management, or maybe having a lot of them go to the 5th floor. We are also, besides surgery, we have a large medicine population. We take care of anything from ARDS, multi-system organ failure, to GI bleed, drug overdose, sepsis, pretty much you name it, we take care of it. We also have a very active cath lab. We have a lot of code-STEMIs, and those are coming to us sometimes from St. Charles, from river parishes, and from Kenner. We get transfers in from as far as St. James, and they come to our cath lab and have intervention. We also do a lot of leg, limb ischemia work, trying to salvage the limb instead of amputation. And so our doctors have a program here, which is very unique, because a lot of times, the first thing doctors want to do is, say, oh, you have to have an amputation, as there's a large diabetic population around in the Louisiana area and surrounding areas. And so we have a couple of doctors that are working on, saving the limb, as we have the hyperbaric chambers here too for wound care. So we offer a lot of different things here. We do a lot of targeted temperature management. And we're also primary stroke center. So as part of our being part of the comprehensive stroke center at Jeff Highway, we're a major part of that spoke of the wheel, because we can also keep some of our TPA patients here if they're not a very severe stroke. But a lot of times we do transfer to Jeff Highway, and we do take care of some of our patients here that don't require, interventions for bleeding, active bleeding, and things as such. So we're really excited to have gotten our second designation for primary stroke, and look forward to caring for those patients.
Thanks for that overview, Tina. And I'll say that I've had a great time over the years reviewing the neuroendocrine tumor program at the Ochsner Kenner facility. And I'll tell you that that's a nationally renowned institute where it's really a destination center as well throughout the country for neuroendocrine patients to come to Kenner, Louisiana, Ochsner Kenner campus to receive that care. There's just, not a lot of places in the United States that can care for those patients. So it really is very unique program that we offer here at Ochsner. It's primarily and really exclusively within the River Parishes region at Kenner. You know, Tina, I'll also say that the River Parishes, also Kenner campus, really, I like to think of it almost as, you know, an area for patients coming throughout the country because of the Kenner Airport. If anything happens, you know, to a patient, maybe coming off of an airplane, or, you know, they're trying to connect into another.
Yeah, I was just going to mention that our strategic location being near the airport, that kind of works with the neuroendocrine tumor program. We also find ourselves getting patients straight from the airport, but to get back on a plane, have an MI, patients from cruise ships. We have a lot of unique situations where, you know, we're ideally located right off the interstate, right near the airport, and we are the last major hospital between here and Baton Rouge. And so we find ourselves, you know, with Mary being in River Parishes too, we find ourselves taking in a lot of very acute patients, and our patients tend to be sick. It's very surprising what goes on in the building and the highly acute patients that we take care of. And I find that the patients and families are very appreciative of the care that we do provide. So it's very rewarding working here and having the opportunity to take care of these people. And we also have baby services here too on the 3rd floor, which a lot of people aren't aware of, with a level 2 NICU. So sometimes, you know, in the ICU, we do find ourselves taking care of moms that are postpartum with postpartum bleeding, or with their, you know, going into, what's the word? Well, my COVID brain is failing me. They're going into, they're eclamptic, and so they're going into HELP syndrome and have some liver failure. And that also jogs my brain that we have a very sought out GI team here too. People come from, I was surprised to learn when I came here, all over the state and outside of the state. Sometimes they have our GI docs perform endoscopies and other procedures on them too. So it's a very unique place. Surprisingly, there's a lot going on in the building. And so there's not much that we can't take care of here, but it's great being part of the system, because if we can't take care of them here, it's just a 15-minute ambulance ride, or we've even sent patients by helicopter to Jeff Highway because they were that critical.
Yeah, thanks, Tina. I appreciate that overview. And one of the things I was mentioning earlier too is that, you know, our river parishes really community care, where, you know, these are community hospitals and facilities that are intended to care for those within our local communities in which the facility exists within. But there's also this really unique aspect of the river parishes, especially Kenner, where you do get the opportunity to also see international patient population and national patient population, just because of the airport and that being in that corridor like Tina was talking about. So really cool, unique opportunity just based on the geography of the campus that you really can't find at other places. Now, Mary, my next question is going to be for you. We essentially have talked about the geographic location of our facilities, and then also a little bit about our patient populations. But I do want to do a little bit more of a deep dive, Mary, and if you could talk a little bit more about the various types of specialties that may be available to our nurses, specifically our nurses within the river region.
Sure. I think Tina did a really good job on the overview of, you know, the different populations that we take care of. But across the river region, between Ochsner, Kenner, Ochsner, St. Charles, and river parishes, we have lots and lots of specialties. I mean, you start with emergency medicine, ICU, med-surg, tele, psych, med-psych. We have L&D, we have mother-baby, we have NICU, surgery, cath lab. We have clinics, we have pain management, we have interventional radiology, and more. I know I didn't name them all, but I really do feel like we have an extremely large amount of specialties between the three hospitals that I believe that we have something for everyone in the River region. It is a very special community. And so I think we definitely have a very, very vast amount of specialties for nurses.
Thanks for that overview, Mary. I know that I've worked with new grad nurses for over 5 years here at Ochsner, and it's really become it's been my main focus for a very, very long time, new graduate nurses. And I do get a lot of questions from new grads when I do career fairs and whatnot, other presentations at the school, at schools about, they ask me, well, they tell me how nervous they are about that first job out of nursing school and how they want to just make sure they make the right decision on that first job, in terms of finding a place that's going to support them as it relates to their training orientation, but then also giving them the opportunity to kind of explore nursing, the world of nursing in real life, apart from, academia and school. So essentially, Mary, can you just talk a little bit more about why the facilities within the river parishes are a great place for a new grad nurse to start their nursing career?
Sure, I would love to. And I also love talking about new grads and, where the best places to start. And, everybody has to start somewhere. So having that support system is the most important thing to help a new graduate succeed. And in my opinion, the River region is a great place for new grads to start, really because of the things we've mentioned with the complexity of patients that we serve. We obviously see a wide scope of patients, some with very high acuity, but we also work together across the units to make sure the patients are getting the best care possible. There's really a family feel within the River region. I know myself, and as well as the other directors, we reach out to each other for support a lot of times. And my favorite part about the River region is the way we do work as a team. And there's this, like I said, there's this family feel, this culture that, it's kind of, you don't understand it until you work in the region. But we really do support each other. I would say that I could pick up the phone and call any of the nurses, directors, administration, anyone, and say, hey, I have a flat tire. Can you come change my tire? And they would literally be there. I mean, same thing with, obviously within the hospital, we support each other a lot, always bouncing ideas off of each other on how we can improve, things for nurses as well. We want our nurses to feel like we care because we do care. And for the new grads, you get, an extensive orientation in each department that you would choose. And then our education department actually does, special classes with the new grads when you start. So that way we make sure each nurse is being set up for success.
Thank you for that, Mary. And you really started my segue essentially into the next question, as it relates to teamwork, because Renee, I really want to talk to you now about your experience, how you would essentially describe how Ochsner Kenner works with the other facilities within the River region in order to support the team approach, if that makes sense. So if we look at all the facilities that you actually mentioned earlier that make up the River region, a bit about why or how Ochsner Kenner supports the team. And if you want, you could even bring up a real life experience, or just talk, broadly about how Ochsner Kenner does this.
Sure, Sam. Great to piggyback off of what Mary was just sharing, and she used the word team. So we're at an advantage and we're able to leverage many things, including supplies, resources, equipment, as a group. Many of our leadership team share departments and responsibility for departments throughout all 3 campuses. And with that, that creates that culture of alignment It creates the shared vision and processes and operations. So we do absolutely have and take advantage of the opportunity to share our resources, which includes staff. We've had instances many times, and this benefits the community greatly. In addition to the obviously the employees, it benefits the patient as well, because, you know, during our peak season of flu and illness, and unfortunately COVID, we are absolutely able to get our patients moved if we can timely to between the hospitals, to get them in an inpatient in a bed to be seen and develop a plan of care quickly for them. We transfer patients just last week, actually, when most of our hospitals within the health system were at peak capacity. We do that with staff as well, and supplies and equipment. So it's a great advantage to have that culture of team, but to be able to serve the community as well, being a region.
Thank you for that, Renee. And I really, it's such a unique way in which all the hospitals kind of collaborate to share resources, you know, human resources with employees, but then also, you know, clinical resources or medical resources such as, you know, supplies. And I think it's really nice to be a part of a larger organization where you can kind of tap into those areas that you may need further assistance for, but then also at the end of the day, have that unique standalone identity as, you know, your own facility or your own campus, but then also be within a really large support system that you can rely on when you need the assistance. Now, Mary, I kind of want to also ask you the same question that I asked for Renee, but from my understanding, you have a very unique position within the organization, because you really have pretty detailed involvement with our river parishes ED, and then also as our house supervisor at Kenner. So you really kind of see a lot of different areas within the river region itself. So can you, your experience within those areas, can you explain from your perspective how the facilities work together as a team?
Sure. You know, out here in River Parishes ED, even though we're an off-campus site, I still feel very supported by the River region. And, you know, taking the house supervisors and risk sitters from Kenner and, you know, leading them has taught me so much about how hospitals can work together and across units and across, you know, hospitals that aren't even located in the same place. You know, our house supervisors do a really good job of prioritizing and identifying needs across the whole system, the region. So, you know, even like really a real life example is last night, Kenner ED had a call in, and they needed help. And so one of my nurses was able to pick up a shift at Kenner and help them out. And then also, as I'm sure, you know, anyone else could attest to, you know, as far as like PCTs and sitters, and, you know, we really come together and collaborate as a group to see, you know, where the priority is. And it's really awesome to see just the collaboration across the whole river region to do what is best for the patient and what we can do to serve the patients. And like Renee said, last week we transferred several patients to St. Charles Hospital from Kenner because Kenner was at capacity for beds. And so, you know, what are we going to do? We're going to rise to the occasion, and we're going to try to find those patients an inpatient bed so they can get the most efficient and the best care that we could give them. So it really is it's really awesome to see everybody work together to try to do what's best for the patients, because that's what it's all about.
Thanks, Mary. I appreciate you bringing up that personal experience, especially being so recent. It's really, I think in general, we all learn best too from, you know, stories, and storytelling is one of the oldest forms of knowledge, well, how you acquire knowledge at least. And it's really nice to hear how Ochsner has provided, you know, these resources to our facilities and how we work as a team in real life examples. So I really appreciate you drawing upon those experiences to help answer that question. Now, my next question is actually going to be for you, Tina. I know that Renee was really touching up on the culture earlier, so I appreciate Renee helping set us up for this question here. But essentially, Tina, how would you describe the work culture of the River Region? And if you want, you can even help define like what is work culture and why is it important, and how would we describe it here at Parish's region?
I would say it's a family-oriented work culture, and it's a culture of safety and putting the patient first. And culture is something that it's not something you do. It's how you define like your nursing and it's just what you do. It's not just the theme of the day. It defines, the decisions that you make each time you're in a situation or you're trying to decide, how should I handle this difficult situation? How are we going to get through this? Like the focus is always the patient first and, supporting the team and safety. So it's how we run the building. It's how we function. And it's what we're going to do and helps guide our decisions. But getting back to the culture, it gets back to taking care of patients the way we would want our family taken care of too, is kind of what guides us. And, welcoming, family members in and being compassionate and caring in how we approach these unique situations as, they find themselves, in unexpected settings, being in the ICU unexpectedly, or, coming to the emergency room with your child and you're scared and getting information, after a procedure, finding out you have cancer, whatever the situation is. It's being able to put yourselves in those people's shoes and being able to, understand how they're feeling and that they may be having a really bad day. So I think that we also have compassion for each other at work, because we all are dealing with a lot, especially with the year that we've had. And so it's how we take care of each other too, that helps make a difference at the end of the day, and how we interact across the multidisciplinary teams. And, we care about each other at work. We care about the providers. We care about our therapists, our housekeepers, whoever it is. It takes all of us to work together. And the culture is such that, everybody's job here is important. And it takes all of us, housekeeping, dietary, all the support services, the people bringing our supplies to take care of one patient. And we all impact our patients. And so we're all equally important, and we can all make a difference in the outcome of the patient. So you very much see and feel that when you're here at Ochsner throughout the system. And, we put we talk about our 10-5 way. And what that means is if you're, 10 feet away, you smile. If you're within 5 feet of someone, we're supposed to acknowledge and greet them verbally. And it's how we treat each other, and it's how we treat our guests when they come in. So I think it's kind of what makes us unique.
I appreciate that. And I'll tell you, based just on my experience over the years, I'll say that the River Parishes really also has a culture of inclusion and emphasizing on compassion, because, I'm not a nurse, but a lot of my responsibility here at Ochsner is to recruit nurses, and a lot of that is dependent on me understanding how, the world of nursing. And I'll tell you that every time I've gone to, in all the facilities within the River Parishes region, I'll ask a question, and I'm sure it's probably, I would consider it maybe, I don't want to call it not a dumb question, but, I'll ask questions where, you all will really take the time to explain things to me on how things work, no matter what type of question it is. And I always have felt comfortable to talk to y'all, to get answers to questions I have. And I really think that, being able to go to nursing leaders and ask, questions that, you really feel like to, answered, and y'all always give great answers, and you never have made me feel less than for not knowing something. And I'll say that I've really appreciated that over the years. And that's something that not a lot of places always are going to offer, but we really have that type of culture at in the River Parishes region, really throughout all of Ochsner. But I've really experienced it at the facilities within the River Parishes region. So I want to thank y'all for, including me and always being there for me when I need y'all. It's really something very special that I can attest to. Renee, my next question is actually going to be for you. We had Mary talk a little bit about earlier, new grads in the, why our River Parishes facility is a great place for our new grads. But Renee, could you actually also talk a little bit more specifically about the nursing education and professional development and training and orientation, not just for new grads, but for our experience as well, and what that looks like?
Absolutely, Sam. And I just can piggyback off of what Tina was sharing about the culture. We have a culture of learning here at Ochsner. Absolutely 100% supported, not just in nursing, but in every discipline, and for all employees. We're continually learning and gaining knowledge, and it's very important for our nursing staff. This is a subject near and dear to me. We have a very, very robust onboarding process and education process for all our nurses, new grads and experienced nurses. We're very fortunate each campus here in the region actually has their own education department and their own either director of education and their nursing development, professional development department. We partner together, all three, to assess, the needs for the region, the learning needs, and which changes over time. There's basic curriculum, but they collaborate together to develop our onboarding process. All nurses, new and experienced, attend a core for the whole Ochsner Health System. But in addition to that, in the River region, you also attend an additional 8-hour orientation specific to us. You learn about our policies, specifics, our quality specifics, all different aspects of the facilities and region and how we operate. And then also, all nurses, every nurse is assigned to a preceptor, a designated preceptor that they get to spend their onboarding time with, and also a mentor. We have a mentorship program, which both the preceptor and mentor programs are pretty rigorous. They go through training and academies, so that we want to give our newer employees a great experience. The duration of everybody's orientation, depending on experience, except for the new grad, is pretty much determined by your skill and the area of the specialty. For Tina and ICU and critical care and ED, for example, those areas are going to have probably a much longer, an extensive orientation to that specific type of nursing. For my areas, for the med-surg and telemetry areas, for new grads specifically, we have a very exciting new program. It's very unique, and it is called the Transition to Practice program. It's a very structured 12-week mentorship program that includes classroom work, a lot of unit progressive patient care through the 12 weeks. And pretty much at the end of that new grad experience, they're able to function as what we call an advanced beginner, which is unique and different from the former orientations that most hospitals and actually that we used to have. So we're very excited about this new transition to practice program, and it's a unique opportunity for new graduate nurses. And we've had great successes with that this past year. For our experienced nurses that are coming to join our teams, there's several opportunities for professional development. We're very excited that we have a simulation lab at our main hospital at Jefferson Highway. In that simulation lab, we can send the nurses to get various experience with practicing, say they haven't been in practice in a little while, practicing with their skills. In emergent situations, it's very neat to watch, but they actually simulate, real life threatening situations and help train the nurses how to do that. We do offer multiple standalone courses pre-COVID, COVID, those have kind of the in-person, as we're doing a Zoom now, have not been as frequent, and we hope to get back to those soon. We have at Ochsner Learning Institute, which is our online learning network, which we offer many of the leaders in the organization in the River region teach those courses. We also have a mentorship program for our experienced nurses. We help develop career paths for our nurses in that mentorship program and help them get, where they like along. You can spend your lifetime here at Ochsner as a nurse and get to plan that career path and development with their mentor.
Thanks for that overview, Renee. And I'll say that it's quite a feat for you to have even talked about all those points, just because there is just so much available to our nurses at Ochsner as it relates to training and orientation, professional development. We have an entire department, as Renee said, our system professional development. We have an entire department dedicated at Ochsner to professional development. And like I said a few seconds ago, I commend Renee for really going over pretty much almost everything that we have to offer, because it's just so much to offer our nurses. It really is impressive. And one of the other great reasons why joining our team at Ochsner is just such a great idea for new grad and experienced nurses across the spectrum. Just because if you're someone who wants to grow your career, we have the resources for you to do that. And we just have resources to help you get into that process too. So really unique, cool stuff available to our nurses. And I'll say that are really specific to nurses because we really do provide really great exclusive opportunities for nurses, because we know how important our nurses are to the organization and just in healthcare in general. But let me address the elephant in the room though, if y'all don't mind, and it's going to be COVID. And Tina, this question is going to be geared for you. Based on your experience, and I know we've kind of touched up on it. I think Mary mentioned something about helping share beds and transferring patients. But Tina, based on how have our nurses in the River region provided direct patient care during this pandemic? How would you describe that?
Well, it was definitely an all hands on deck situation when we started back in March. And there was a lot of anxiety with everyone, including the ICU staff, as we started becoming inundated with patients. And, they were on the floor, they were in the ICU, they were everywhere as we were expanding. And we had to pull nurses from the OR, from the clinic, from the procedural areas, from PACU, and basically turn the PACU into an ICU, the cath lab, and bring people back to the ICU that hadn't been in ICU in a while, and bring people to the ICU that had never been in the ICU. And we basically tried to work with them and assess their previous work history, and bring CRNAs back to the bedside, and put them with a buddy to work together to get them comfortable again with taking patients. And some people, it was too stressful, and we reassessed and maybe put them in a different area. Some people were sent to the floor. We just kind of gave everybody a job, a buddy, and we created a plan so that we can all support one another during COVID, and create resources, whether it was cleaning, it was taking care of patients, it was getting supplies. And they even pulled people from within the system to send over here too at some point, until we could get other resources in from within the country, from like travelers and things like that. But like I said, it was very stressful because everybody had their own personal feelings outside of how they felt about the angst of COVID and what that could mean for their family and how it could impact them. But at the end of the day, everybody did come together to care for the patients. And did a really great job and supported one another, and we really appreciate it. You know, even one of the techs that supports IR, you know, even brought us like nice picture to hang in our break room, and we had somebody from a Mammo tech that just loved working with us, that was sending us letters, and it was just real. We met people and in ways built stronger relationships with some of the people in the OR that we didn't really know except from dropping off patients, and you know, kind of created a better work environment after. We learned a lot about each other and our team here. So it was an interesting time.
Yeah, and we're really still going through it too.
Yes.
Really experiencing it even now. And I do want to say this too, especially to Tina, Mary, and Renee, since y'all are our three nurses here. I want to thank you sincerely from the bottom of my heart to you and to your teams for being there on the front lines for our communities and taking that risk for all of us to help treat these patients, treating our family members, you know, our friends, our coworkers. Like, you guys have been on the front lines of this and still are. And I really sincerely want to thank you all. It really, you know, it means a lot. So thank you. But my next question actually is going to be for Brooke. And Brooke, I want to thank you for waiting so patiently, by the way, to join our discussion. But really, this is probably what I consider to be very, you know, one of the most important parts of this discussion is going to be, since, you know, you're our resident expert as it relates to recruitment, and essentially we want y'all to really understand a lot about what's going on here within the River Parishes region, so that you guys can get, you know, a view of what it's like to work here, so that you can either now or in the future come and become part of our team here. But Brooke, can you talk a little bit more about some of the Ochsner Health benefits that are going to be available to our employees within the River region?
Yeah, absolutely. So in addition to all of the things that the leaders already described, Ochsner also offers a full benefits package, which includes medical plans, several different medical plans to choose from, vision, dental, 401k, tuition assistance if you feel like you want to go back to school, and that's just to name a few. There's also a lot of different perks that you can get and take advantage of just for being an Ochsner employee, discounts with our fitness center, cell phone discounts. So a lot of different things that you can really take advantage of, you know, just for being an Ochsner employee.
Excellent. Thanks for that overview, Brooke. Can you also talk a little bit about maybe some of the current opportunities that might be available right now to join the Ochsner region team? And if so, you know, if not, but if so, what are some of the next steps that someone that's watching right now can take in joining this team? How could they apply, or how could they find out more about how they can join the team?
Yeah, so definitely a lot of opportunities available in the River region. Nursing, allied health, lab positions, environmental services. Really the best way to see everything that's available is to go to our careers website. It's ochsner.org/careers. And once you're there, you can really utilize the site. There's a lot of different ways for you to kind of search if you know exactly what type of position you're looking for. You can search by the position title. If you're not too sure of what you're looking for, maybe you just have a general idea, you can use the filters to filter out the results. You could filter by job type. If you know there's a specific location you'd like to work at, you can filter that way. So a lot of different features on the website that'll kind of help you navigate through and see what's available. Once you do find something that you may be interested in, definitely go ahead and apply, and then I will reach out to you. and kind of talk to you about what the next steps would be. And again, just to help you really navigate through getting you connected to a leader, setting up an interview for you, and then answering, you know, any questions that you might have along the way.
Thanks for that. I appreciate that. And I'm sure everybody watching also appreciates that information. But I do want to say that we've actually reached the end of this discussion essentially. And I just want to say this has been a very informative and enlightening discussion just based on my perspective. And hopefully you all have thought the same. I appreciate everyone's perspective as it relates to our panelists when talking about the various components within the river region and what makes our river region so special. I would like to conclude this Talent Talk discussion by thanking our panelists of speakers for such a unique discussion regarding Ochsner River region facilities and hospitals. I really appreciate you all for taking the time to be part of this. I know y'all are so busy, but you really have taken the time to help support this, and I want to thank you all for that. Now, if anybody that's watching this, any viewers of the video, if you guys are interested in learning more about career opportunities at Ochsner Health, whether they be nursing, allied health, you know, professional opportunities, you name it, please visit. Brooke mentioned it earlier, but I'll mention it once more. It's ochsner.org/careers. That's OCHSNER.org/careers, CARS. And you can find more events like this by following us on Facebook, Careers at Ochsner Health as well. Thanks again, everybody, for joining us today, and have a great day.